So, I promised last time, or probably the last few times, that I would try to be more regular or at least be faster with my videos once I'd had my orthodontist appointments. So today I'm trying to stick to that for you, and it's only been a few days since I last went. The only thing I will say though is, as I may have mentioned before, I do think that it's good to leave it a few days at least after your appointment, because then you can talk about, the reaction of your teeth to whatever tweaks were made last time. So it's only been about 4 days. I went on Thursday and it's Sunday now, so I'm doing my best for you guys. Sorry, timekeeping has never been my strong point. So basically, last time I went, I had a broken bracket, which was a bit of a annoyance, because it was the bracket with the hook on it at the bottom that I used to wear the elastics that I've had to wear. So that meant I couldn't really wear my elastics on that side for a good few days. It broke Monday morning. I called him up to see when I could see him, and there was nothing available before Thursday, which was my scheduled appointment anyway, so I just kind of had to wait. But in the meantime, it drove me crazy because it was not on my last molar, but my second to last molar. It wasn't the last bracket on the wire, so I couldn't just slide it off. It had to stay there, and it was flipping over and sliding across and all of this, like every day, all the time. And because it kept doing that, obviously it felt weird, like there was something there that shouldn't have been. So I always would think, oh, I've got a big lump of food or something down there, start to try and, get it out, and then realize it's a stupid bracket that's just gone wandering again. So that was a bit annoying. And so yeah, he fixed that for me, and while he was doing that, he took a look at the bottom for me and is a little disappointed with the progress on the bottom. We've actually gone back a little bit progress-wise on the bottom. If you remember, he put steps in the wire at the front so that the level of my front teeth on the bottom would even up, and that worked. And then he changed it to a normal wire, and now over time, not really sure why, they've risen again. So we're still waiting to balance that out. He thinks it could be because obviously the top and the bottom don't quite fit how it's supposed to yet, and with lots of work and movement on the top, that may be pushing the bottom teeth around a little bit and stopping them from doing what they need to do. But let me show you, they've gone all uneven again. So that's a bit of a pain, but it's not the worst problem ever to have. What we're going to do is, he says, put in a new wire next time, same as we did quite some time ago before the steps were put in. He put in an eccentric wire, which means that it's going to have a wave in it. So it's going to go up over here, down over here where they need to be pushed down, then up again over here. So hopefully that will push this side up, push that side down, and then everything will be leveled off. But there's no guarantee, we don't know how my teeth are going to react to that, so all we can do is try it and see. We may have to go back to putting the steps into the wire again and see if that works. But the bottom, to be honest, I've never been that fussed about. I find that you can't really see the braces on your on the bottom teeth anyway. So it's more, I'm more bothered about the top getting fixed and having the top braces off, even if the bottom ones have to stay on for another 6 months or whatever after that. I really actually don't particularly care. When I smile, it's all top teeth anyway, so at least then, I'll feel more confident smiling. So yeah, the bottom's not doing so great, but we'll get there eventually. As for the top, he's really happy with the progress. He tightened my gap closers again, and he said that should be the last adjustment. He reckons all gaps will be gone by my next appointment in 2 weeks, so that was so good to hear. I'm so excited. And if that is the case and there are no more gaps next time, I get to have another wire put on, a normal one without all of this stuff going on up here, and it'll be a white one as well, like the one I first got right in the beginning of the treatment, because after such a lot of movement, he said that he wants to stabilize my teeth for a couple of weeks by just having a nice soft wire in there. to let them level up again, because I don't know if you can see, this one's lower. You know, they're not quite lined up how they should be, and they're also stepping a little bit because of the pressure being put on them by the gap closers, and the wire's pushing them backwards, and I think some are more eager than others, so I don't know. Please excuse my hoarse voice today. I have no idea what's going on. Hopefully I'm not coming down with something. So yeah, he tightened them, and I can see that the gaps are closing really, really quickly. I mean, it's gone basically on this side. On this side there's still a little gap left, but basically it's gone, and that's so frigging exciting. I'm really, really happy with how fast this last stage of it's moving, and I booked a holiday with one of my best friends in February to go to Thailand, so that's my new goal. I think I may have mentioned that actually in another video, that obviously I was hoping, for some strange reason, God knows why I got it in my head, I had been hoping to have my braces off by my birthday, but now my new goal is hopefully my braces will be off by February so I can have a big beamy smile in all of my holiday photos. So yeah, that's just about it. Yeah, I'm gonna have a double wire change next time I go, so I'll probably be very sore. The gaps are almost gone. It's so exciting. Oh yeah, one bad thing that I need to tell you about is when he was working on the top, when I went on Thursday, he noticed that a few gaps were appearing, 3 gaps throughout the front between each of the teeth. Just little slithers, but, you know, they shouldn't be there, obviously. So when he did the tightening, this time, of the gap closers, to avoid those gaps getting any bigger, he put on an 8 ligature, which, if you remember, is the crisscross type that weaves in and out of all the brackets, and it's basically to hold those teeth together solidly. I'll show you now. In the past I've had white ones because they're less visible, but I think he didn't have any this time, so I've had to settle for metal. Settle for metal. So these teeth are being held together very strongly at the moment to avoid those gaps reappearing, and to be honest, it's really, really uncomfortable. I'm finding that because there's basically no space between those teeth, I'm a little bit lispy. Because obviously there's no gap there for the air to escape through your teeth, so I'm feeling a bit apart from that though, basically what's bothering me the most about it is because my gum has swollen up badly behind where he's put that in. This happened to me a few weeks ago, but it was only for like a week, and I started using a new mouthwash which was supposed to help with that, and it really did. And I bought some new floss as well, which is designed especially for people who have braces, and that helped a lot as well, because I went to see the dentist to get a professional clean, and he noticed the swelling and told me that I should probably buy a new mouthwash that was especially for like swollen gums and stuff like that, and that I should floss more often. I mean, I've never been bad with flossing, but I have found it more difficult since these brackets have been on the outside. With the Incognitos, it wasn't as difficult because you could just get right in there from the front. But with these covering the entirety of the front of my teeth, it has been quite difficult to get right up to the gum line. You know, you can only floss in so far before you hit the wire. So I got some new floss, and that has been helping a lot, but my gum's just really irritated by this pressure that the 8 ligature is putting on it. And I remember that this happened to me one time when he put on a power chain at the side of my teeth quite some time back. I woke up in the morning and my gums were really swollen. So what I did was took off the power chain for a few hours, took a few anti-inflammatories and waited for it to all go down and settle, and then I put a new power chain back on. At the time, there was a lot of power chaining going on my braces, so I bought some myself on eBay so that I could do that kind of thing, so I could replace it myself if I wanted to, because as you know, any of you who have had them, you know that they discolour a lot, and you know, as soon as you eat curry or like spaghetti bolognese or something, then they're bright yellow straight away. So I bought these on eBay for about $2, so not too expensive, and it's just one big long power chain that you can cut to size for whatever you need. So each time I would notice my chains getting discolored, I would just replace them myself, because it's never nice, you know, to think that when you're smiling people can see yellow stuff in your teeth. You know, that's just not good. So yeah, what I had done is taken it off, let it settle down, and put a new one back on exactly as he had put it on, but just yeah, to give my gums a break. With this I can't do that because it's a wire that he's put on. I can't do anything to relieve the pressure, so I've just been taking a lot of anti-inflammatories and flossing and using my mouthwash a lot, hoping that all of that will calm it down. But it pretty much you know, it blew up straight away as soon as he put that on, and even when he did put it on, I could feel that it was very tight, and I knew this was probably going to happen. So when I next see him in 2 weeks, if it hasn't settled down, I will ask him to loosen it up, or even maybe try and get an emergency appointment with him next week to see if he can loosen it a little bit. I mean, I know it's there for a reason, but it is causing me discomfort right now. So yeah, I'll talk to him about that anyway and let you guys know what he said. The only other thing I have to report is that since he tightened my gap closers last time I saw him, I can't actually bite down properly. Because the gap closers obviously are pushing my front teeth backwards, this one tooth here that is leant forwards quite a lot hits my upper incisor here, and that hits way before my back teeth can close. So if I actually just do that, you can see my teeth don't close. So in order to eat at the moment, I have to force that. So I'm pushing the teeth like this, and it really hurts. And also it's going to have an opposite effect to what we want, because this tooth at the top is trying to move backwards to where it's supposed to be, but because this tooth down here isn't where it's supposed to be, it's stopping that from happening. I mean, perhaps with the pushing from the top tooth hitting it, maybe it'll move back into place, but that again is something I'm just going to have to wait and see about. You know, if it's still bothering me once again by next week, then I'll probably try to schedule an appointment with him and see if he can maybe put a kink in the wire down here to push that tooth backwards a little bit so that I can actually chew properly. But again, that's something he'll have to decide on. If not, I'll have to just grin and bear it, which is something you get quite used to when you've got braces. So yeah, that's just about it. Sorry it was such a super long video, but I did have quite a lot to tell you this time. If you have any questions about any of what I've talked about, just let me know. And of course, please, anybody who's going through their treatment at the moment, keep me updated with your progress, because I love hearing from you guys, and I just love knowing that, you know, watching my videos is helping you. And yeah, and you telling me about your experiences actually helps me as well, because a lot of the things that happen to me, like this gum swelling and stuff like that, when people come back to me and say, no, don't worry, that happened to me too, it makes me feel a lot better. So yeah, let's keep helping each other out, and I will be back with my next update as soon as I have more news. Bye guys, and have a good weekend.